Fetal alcohol syndrome. Fetal alcohol syndrome is a collection of growth, mental and physical problems that may occur in a baby when a mother drinks alcohol during pregnancy. Alcohol is a teratogen that affects multiple organ systems, for example, heart, joints, kidneys, visual systems, auditory systems, most characteristically the central nervous system. Features of fetal alcohol syndrome include facial dysmorphism, short palpebral fissures, thin upper lip, smooth philtrum, growth retardation, and central nervous system involvement, structural and/or neurobehavioral. Intrauterine alcohol exposure can cause reduction in the volume of the caudate, striatum, thalamus, and cerebellum, resulting in abnormal reflexes, tone, and coordination. A decrease in the volume of the frontal lobe and dysfunction of the amygdala contribute to deficits in executive functioning, impulse control, and emotion regulation. Other neurobehavioral manifestations include cognitive impairment, learning disabilities, and social skill deficits. Children with behavioral difficulties, distractibility, hyperactivity, hitting, growth retardation, poor coordination, and facial anomalies may suggest fetal alcohol syndrome. Fragile X syndrome is caused by unstable CGG trinucleotide repeats on the X chromosome. Features include intellectual disability, a long, narrow face, large, protruding ears, macrocephaly, and macroorchidism. Cocaine exposure in utero is associated with hypertonia and tremors in neonates and impairments in attention, language development, and behavioral regulation in school-age children. It would not cause the facial anomalies seen in this patient. Rubella exposure in utero is associated with congenital heart defects, hearing impairment, and ocular abnormalities, for example, glaucoma, cataracts, retinopathy. Trisomy 18 Edwards syndrome is associated with a small mouth and prominent forehead, pointy ears, and flexed, overlapping fingers. Horseshoe kidney and congenital heart defects may be present. Survival beyond 1 year of age is uncommon and associated with severe intellectual disability. Facial features in trisomy 21 Down syndrome include epicanthal folds, upslanting palpebral fissures, brachycephaly, back of the head symmetrically flattened, flat nasal bridge, and protruding tongue. It is associated with varying degrees of intellectual disability. Typical features of fetal alcohol syndrome include facial dysmorphism, short palpebral fissures, thin upper lip, smooth philtrum, growth retardation, neurological abnormalities, and behavioral difficulties.